Hello, my name is Hannah Bush, and this is my Multicultural Psychology PowerPoint presentation. I have chosen the topic Cultural Competence in Society and the Mental Health Workplace. What is cultural competence? For around 50 years, cultural competence, loosely defined as the capacity to comprehend, value, and engage with individuals from cultures or belief systems that differ from one's own, has been a crucial component of psychological theory and practice. It is now regarded as one of psychology's basic competences because it has become such an essential component of discipline. It is also seen by the federal government as a key tool for assisting in the eradication of socioeconomic, racial, and ethnic gaps in health and mental health care. Some examples of cultural competence are having empathy for others from different backgrounds, making efforts to learn about other cultures, active listening to others when they're speaking, and realizing one has cultural bias and trying not to let it affect how one interacts with others. What is a society and why does it affect us? Part 1. A society is a sizable population that coordinates their living arrangements and decides how to proceed and divides up the necessary tasks. A country's entire population or a group of related nations can be referred to as its society. Society affects each and every person because it often changes the way we interact and speak to one another. For example, one's personality, likes, and dislikes are likely to change when talking to a different person in order to fit into what they believe the other person would like the most. Society in itself is a culture of its own because the people in it adapt to fit the mold. General cultural competence in society. Cultural competence is important within society in order to create positive relationships, connections, and assist in community building in diverse populations. It also impacts many things within society, such as education, immigration, housing, and healthcare. Challenges in achieving cultural competence on a societal level. Part 1. Historical inequality still plays a large role in why cultural competence is hard to achieve, mainly because people still have biases whether they are aware of them or not. Similarly to historical inequality, many people also believe in stereotypes and prejudices that are thoroughly engraved within society, and many people are resistant to change, which makes these stereotypes able to thrive. Language barriers can make it difficult for other individuals to communicate their cultures with others. Referring back to the previous slide, stereotypes and biases are often assisted by ignorance and lack of awareness/education about a certain culture or background. For example, when someone may only know things about a culture from TV and media, which often glorify stereotypes. How to avoid cultural misunderstandings and conflicts, Part 1. Using different forms of communication can assist in helping to communicate with individuals from other cultures. Different forms of communication can consist of facial expressions and body language. It is also important to understand that not all cultures have the same way of communicating. For example, some cultures are loud as a form of happiness, while others are loud due to anger or aggression. How to avoid cultural misunderstandings and conflicts, Part 2. Be able to work around cultural boundaries and be able to accommodate to the best of one's ability. Respect the diversity that is inevitable throughout the world. Look to others for help when something doesn't make sense and broaden one's understandings for the culture. What about bias? As a human, we experience many different forms of bias. Some examples of bias include ageism, sexism, beauty bias, gender bias, and so many more. However, when working in the mental health field, it is important to overlook any subconscious bias one may have and treat everyone equally, regardless of age, race, sex, and culture. How does poor cultural competence affect mental health? Although not many would like to admit it, people care what others think about them. If society has a certain viewpoint of a culture that isn't true, it can take a toll on the people within that culture. For example, If a black man is constantly being told that he looks sketchy, it may take a toll on his self esteem, and after a while, he may even start to believe it. What are fields regarding mental health? Marriage and family therapists, community health workers, social workers, substance abuse counselors, and psychiatrists. These professionals and many more all require the employer to have an open mind and or be culturally competent to the best of their ability in order to help the public as best as they can and get the results that the patient both wants and needs. Common misconceptions about cultural competence in mental health care. One must know about all cultures in order to be culturally competent. Believing that one already knows enough and does not need to put effort into learning about existing cultures. There is nothing left to learn in terms of culture. Learning about one's culture will make one preferential to that culture. Challenges mental health professionals face with diversity. Providing care to a multicultural culture that is compounded by literacy challenges is a growing challenge for doctors and mental health professionals. Physicians must comprehend how each patient's socio-cultural background influences their health beliefs and behavior in order to provide safe and high-quality health care for all patients. Benefits of cultural competence in the mental health field. A better bond with your patient. The patient is more open to trust and sharing experiences if they feel comfortable. More thorough understanding of the patient's background and beliefs can help with deciding how to proceed. Training and resources. There are many websites and programs that offer cultural competence training for healthcare and mental health care professionals. Training in cultural competence for healthcare workers emphasizes knowledge and abilities that respect diversity, comprehend and address cultural differences, and raise understanding of the cultural norms of care organizations and providers. Ethical dilemmas. When working with people of all different backgrounds, it is common for one's beliefs to clash with the patient they are talking to. There are many times where an ethical dilemma may arise, and the mental health professionals may not agree with the point the patient is trying to make. However, they must remain professional and try to think logically. An individual's culture can change their way of thinking and make them see things in a different way. That is why it is important to learn and process other cultures. How to manage ethical dilemmas. When dealing with cultural differences and moral quandaries at work, be modest and inquisitive. Consider and question your own presumptions, assessments, and prejudices when moral conundrums resulting from cultural differences occur. Try and keep a sensitive and understanding environment. Closing comments. Cultural competence is a key Sorry. Cultural competence is a complex topic that takes time to work on and understand. Some key points to take away are eliminate bias, listen actively, learn as much as possible, be open minded, understand how one's culture largely affects who they are as a person. Thank you.